just so small.
Where it just jettisoned.
Hey there, this is the Small Stuff Podcast. My name is Kyle Roebuck. This is the intro. Let's start the show.
Hello, everybody. So today we've got Lauren LaMantia.
Ooh, you said it right?
Yeah. So I think I said it right the first time. I said it wrong when we first met.
Yeah.
Because I'm from the South.
Okay, yeah. You did good.
LaMantia.
Yeah, or LaMantia.
Oh, LaMantia. You get LaMantia.
Yeah.
Probably said that the first time I had you on, too.
That's right.
Real quick, before we get started, make sure you are following Small Stuff Podcast on Instagram. Also follow Small Stuff Media on Instagram and About That with OB on Instagram. Make sure you share the podcast with friends and family, anybody you think might be interested. Also, we have stickers and keychains still on the website if you want one. Too late to get one for Christmas if you were planning on doing that for some reason. But still go get one if you want to support the podcast. And I think that's all. So we're going to jump in. Today, what are we talking about, Lauren?
We are talking about Cervical Cancer Awareness Month and my journey with cervical cancer.
Right. So, guys, I don't know if I put a warning on this episode because I don't know where we're headed or how deep down the rabbit hole we're going. But it might be a little graphic. So if you're not down with that, maybe pass on this one. I don't know. If you can stomach it, go for it. I don't know how it's going to get. I'll put a warning if it's really bad.
But I really love to say, as a guy, this is really important to you too, if you care about the women in your life. So don't just think, some chick is on there and she's talking about her cancer story, because it's really important to the men too.
Okay. I'm interested in hearing it because I honestly, admittedly, I don't know much about cancer in general.
Yeah.
I know what I guess your general person would know.
Mm-hmm. Cancer sucks. It comes, it does this, it does that. You have some chemotherapy, some general stuff.
And I've got uneducated opinions about it. I think, I don't know that this is a fact, but I heard it somewhere. I don't know. I haven't researched it, but you're either going to get cancer or you're not. I don't know if that's built into you or not. I heard that somewhere.
Never heard that.
I heard that somewhere. There's something, and again, it could have been some bullshit that I saw. But some genetic markers.
Well, everybody's doing so much research all the time, and everybody has their own opinion on what they think it should be and shouldn't be, and this comes out and that comes out. Even from when my journey began to now, I am hoping there's a hell of a lot more improvements from when I had it.
Mm-hmm. So when you found out, when was that, and how old were you then?
Okay, so I found out. We're going to take ourselves back a little bit.
Okay, this is yours. Floor is yours. Tell the story.
This is September 2008. So I had just turned 33. And I had my kids. They were 8 and 9 at the time. So I'm going to my exam like you're supposed to every year. I didn't go 12 months. Maybe it was 14, 15 months, let's say. Okay. So not enough, 3 months is going to make a really big difference. But so important that you have to just keep going. So here I am. Now, women, you're going to get me. Men, you're going to say, holy fuck. But I'm sitting on this table and you're kind of propped up a little bit. You're not flat. You're kind of sitting up at this angle. Your legs are sitting up in these stirrups.
Right.
And you're just spread to the wind.
Yeah.
You're just wide open there.
That I knew.
Okay. Yeah, that you knew. Male doctor, which I couldn't care less what it was. Didn't matter to me. You get this nice tool. Okay.
Yeah. I think I've seen these.
Speculum that they stick inside of you, and then they pull it open. Yeah. And you're really all spread out.
It looks like a medieval torture device.
Yeah. And it's like, they call it with a duck bill looking something. It's like long. Yeah. It's like a duck bill. It opens up.
Right.
Psh, shove it in. Crank you open.
Yeah.
All right.
Oh.
Crank you.
Is it like a crank, or do they just squeeze, or like?
It's a really nice metal pop sound.
Oh, I bet that's great.
It's really, really great.
But that's great to feel.
And it just feels so wonderful going in.
Yeah, I'm sure. Nice and cold.
Yeah, it's cold.
They don't have warmers for these things? They should.
They really should. Like, dude, hold
how's
it in
that
your
not a thing?
hand
There's
for
a-
a second, maybe
there's
before
a-
you put it
Yeah,
in.
there's a market someone's
No.
not tapping into.
But it's, and I would think maybe now, no, not now, because I go to my doctor. It would be like plastic. It would be like something else other than this metal guy. But I guess for sterilization.
Surgical steel, I'm imagining.
Surgical
yeah.
steel, yeah.
Yeah.
So you hear the big pop, you're opened up. Okay. Doctor's there, and he's looking. I have the most intense memory that at the end of this table I'm sitting in, he has this long mirror, long metal pole, mirror kind of angled, and he pulls that mirror in front of me, spread wide open,
Mm-hmm.
and there's that tumor looking back at me in the mirror. It looks all like a brain, like you would think a tumor would look.
Right.
Okay, just right there on my cervix.
Yeah. Did he say anything before that, or did he just like dramatically?
No idea.
Okay.
I have
yeah, you don't,
no
okay.
idea.
Gotcha.
No idea.
Gotcha.
So he's like, well, this doesn't look good. And I'm thinking, no shit.
Yeah, no shit. Yeah, that's not supposed to be there.
And in my mind, it was the size of a golf ball.
Mhm.
Okay. I don't think it was that. I really don't even remember how big it was. It was probably like a big gumball maybe or something. I mean, if you can literally see it,
Yeah.
I still can't get over that image that I just saw it up in there.
Yeah. Not being a woman myself.
Yeah.
It's hard for me to imagine that you wouldn't like feel that. I mean, I guess if it's slowly forming,
Because you have all that
used to it.
space.
Yeah.
Like, think about when you have sex. You need to have that space to get the
Right.
boy in.
Yeah.
You gotta have space to get the baby out. So if
Right.
something's growing there, you're
It's
not really
gonna
gonna
be super noticeable.
feel it
Yeah.
unless it starts getting really big, and then you're gonna feel it during sex or
that
something.
makes sense. Yeah.
So I had no symptoms, nothing. 2007, perfectly clear, perfectly healthy, no problems. So again, spread open, got this thing. Obviously, something's wrong.
Mm-hmm.
I seriously don't remember anything. I don't remember him saying anything. I don't remember anything after that. And I just know going home, okay, there's something wrong. I know he said he had to take a biopsy.
Mm-hmm.
Okay. And then we're going to run some tests. Okay. So here it is. If you ask cancer patients, they know dates. Okay.
Mm-hmm.
They know dates. So it's September 22nd, 2008. And I didn't go to work that day because this is like 2 weeks now. I'm waiting. You know, you're waiting patiently for this answer about something. And, and by the way, when they take a biopsy, they're just kind of crunching this piece off of you. So it's not like you can't feel it.
I thought it was like when they do I've only got like references from like shows.
Yeah.
Where like when they take a biopsy of something, it's like a little piece, like a little.
Well, it is, but you
But it
still
just
feel
feels-
it.
okay, I got you, I
still
got you.
feel it, and it's like a little claw. All
Oh,
right.
that hurts me.
Yeah. So obviously he closed me all back up, you know, boom, boom, boom. So I didn't go to work. And I was working in the schools, 7 years at the same school. They just transferred me to this new school. I work with children with special needs. And this was weighing so heavy on me. We just started the school year, September. So I was like, I don't feel right. I'm staying home today. All right. So I'm sitting in my recliner, looking out the window. Price is Right is about to come on. I'm just kind of hanging out. And it's 10:52 a.m. The phone rings, and you see the caller ID come up on the TV. And that was the home phone, you know, back when we actually used home phones.
Right.
I clearly knew who it was. I'm like, nope, not answering it. Not today. You are not answering it. If I don't answer it, then I don't have to face it.
Right.
All right. So call and I don't answer, and okay, I'm fine.
Mm-hmm.
Then my cell phone rings. I'm like, I have to answer this.
Shit.
Yeah, I got to answer this. So I answer it. And I, again, don't remember anything. It's just, Lauren, you have cancer. Okay. Immediately, I was just so overcome with emotions because I didn't want to leave my kids.
Right.
I was married. I had my kids. I had gone through an awful first marriage, and that's the father of my kids, with domestic abuse and violence and things. And there were some scary times that we got away from. So here it is, this second thing. And I'm like, please, no, you can't let this happen. You can't have something happen where my kids are involved or you make me leave my kids.
Right.
So I'm a wreck. That's all I can think about.
Yeah.
And then I remember being in my foyer, go downstairs, I'm in my foyer, and I'm on the phone. So I guess I'm calling my husband, calling family, and I'm hysterical. And it's just all about the kids. And then everything kind of goes blank. I really don't know what goes on next. I don't remember going back to work. I don't remember telling people. I don't remember anything. The next memory I have is I am in the radiation oncologist's office at the hospital, and I see the first patient file made for me. So my name is on that black binder. I'm like, this is it.
Now, as far as cancers go, I know there's certain cancers that are worse than others, like pancreatic cancer. If I am like, that's one, if you got that, you're like, you better catch that shit early.
Yeah.
Where does cervical cancer fall on like your lung cancer, pancreatic cancer? Where is that?
Well, it all depends on which stage you find it.
Okay.
So mine was called a 1B2 squamous cell carcinoma. Like, it was all these names. I didn't care what anything was called.
Yeah.
I knew the prognosis was good.
Okay.
It was definitely good.
Okay.
But I had no idea what I was in for with that.
Yeah.
Or what that meant. My mind is, you're going to get chemotherapy, you're going to lose your hair, you're going to be sick. Like, that's all you kind of associate with cancer. So I had no idea what I was getting into. So I'm at that oncologist's office. We're starting to talk about making plans. Then they put me in a room to try to show me on this VHS tape what I was going to be in for with radiation.
Okay.
So it's a woman in a bed with like this big metal wall. It's like, so you're in a hospital bed, and then there's a big metal wall on the side of her, and your friends and family are like looking over kind of this wall to see you because you were going to have so much radiation they couldn't be near you.
What?
So I'm like, what is going on
Is
here?
that still a thing?
Well, it was not true
Oh.
at all.
Okay.
But here I am saying, what the hell? I'm going to be like radiating or like
Right.
Chernobyl?
What?
Like, this is going to be...
That's so ridiculous. What?
Exactly. I mean, I should have got the first cue when it was a VHS tape. And then, so I'm seeing this. I'm like, this is terrible. This is awful. I don't know what the hell is going to happen next. So it just started with a lot of different testing, and it did find out that I had the HPV virus. Don't quote me on this, but research has shown that about 80% of the population will have HPV at some point of their lives. I was healthy in 2007, tested positive 2008. It also is something that a virus that can stay in your system and present at certain times. And in cervical cancer, HPV is usually the cause of cervical cancer.
Okay.
Okay. So, all right, we're dealing with all this. HPV kind of goes away on its own. All right. So we're coming up with this treatment plan and everything, and it wound up where I'm going through all these pre-testing, which you just don't know what the hell that means. So one thing is they're doing so many different CAT scans and ultrasounds of different parts of your body because your lymph nodes to your lungs to everything has to be okay in order for you to start all this process. So I'm in and out of the hospital all the time.
Before they can even start treating.
Before anything.
That's crazy.
But
I mean, I get it, but wow. Yeah.
What was cool was I had to find a way that I was going to handle this and deal with this. And you can relate to this because I took photos of everything. I had this tiny little pink Pilot phone, again, back in 2008, that was like a transition from a PDA, and it had a tiny, teeny little stylus.
A Palm Pilot, right?
It wasn't a Palm Pilot. It was
Okay.
like the next level cell phone.
Okay.
Pink Pilot.
Yeah. I don't know. The coolest
How
phone
old were you in
saw-
2008?
You don't want to know. Yeah. A child. Yeah.
So I said, I'm taking pictures of everything. So that's exactly what I did. And I was able to keep reflecting on everything And later on in my story, those pictures became really, really important.
Okay.
So we'll definitely get to that.
Okay.
I compared the gowns in the chemo department compared to the radiation department. And these were paper and these were real. And I was like, this is a great day. I'm wearing an actual cloth gown today instead of a paper gown today. So it was really little things that would make me happy.
You're trying to, it sounds like you were finding something to focus on other than what was going on.
I had to.
Right. Yeah.
And
That's what it sounds like.
All this time, I didn't tell my kids.
Wow.
Didn't tell my kids. I wanted to go through treatment for quite some time and then tell them so they could say, oh, mommy's okay.
Mm-hmm.
Like I didn't change. I didn't look any different because I didn't know what I was going to look like.
Right.
And I wasn't going to scare them with something they did not need at 8 and 9 years old.
Something they're not going to fully comprehend.
Of course not.
At that
Of
point,
course
yeah.
not. So radiation, we decide, okay, it's 5 days a week for 8 weeks. So I'm like, all right. But what they had to do to all this work they had to do in the beginning, though, to get me set for this, one thing was I had to lay on this table and they had to create almost a cast under my legs.
Mm-hmm.
So when I sat for radiation, they would put this cast under my legs so I would stay exactly perfectly still in that cast on the table.
Okay.
Then the other thing they had to do was they had to tattoo me. So they had to give me 4 tattoos. So when you get the radiation, it lines up perfectly exactly where that radiation needs to go. So they knew those
Okay.
markers. I have 2 tattoos on my hips, one a little bit higher and one like right down near the pubic bone. So everything was lining up perfectly.
Okay.
So I'm like, I didn't know I was getting tattooed today. Like all these things. Nobody tells you anything.
Do they do that in the doctor's office? Like in the
yeah.
like in the hospital?
Oh, yeah.
They just have a tattoo machine for this?
Yeah.
Is it like a normal tattoo machine?
I don't know.
Okay. Oh, do you have any other tattoos?
Yeah.
Oh.
That's actually my cervical cancer tattoo.
Okay.
It's just little dots, so it's not a big deal.
Oh, okay.
No, it's not a big deal.
They're just like
It's like freckle.
Okay, I got you.
So it was no big deal. But I didn't know, oh, you're going to tattoo me? Like,
Yeah.
what the hell is this? So I start doing radiation. The first day I'm going in, it's 8:30 in the morning. I'm like, got this. You go in the room, you undress, you put on your stupid gown. Everybody's seeing everything. Again, you got to throw all modesty out the window because it just doesn't matter. I sit in there and you're laying on your back and you're just looking up and this machine is just going around you and it's just delivering this radiation somehow. And they're back behind a window and you're just like, I just sit there and I don't know what was going on. They'd ask me about music or something. Yeah, I don't care what you do. It was pretty fast. I don't remember how long it was, but it was relatively quick.
Mm-hmm.
And here I was thinking, okay, get up, let me go to work, have a nice day. Well, it took a few days of that. And I'm like, I can't do this.
Yeah.
I can't go to work now after this, work with children with special needs and be able to do this and have my family and everything.
How are you feeling? Like, I mean, was it
In
like
the beginning, I was feeling okay.
Yeah.
I didn't have any kinds of effects. It can affect you, but it wasn't affecting me. There was
Okay.
I had no problems. Then I didn't have any problems then.
Right.
So I kept that up. I started wearing like stupid, silly socks because that made me happy.
Mm-hmm.
And it made all the people in the radiation place laugh. And oh, here she is with her silly socks and like stupid shit because I'm naked and here's my socks.
Right.
So at least I could do that.
Yeah.
And on one of my last days, I was able to actually take my phone and leave it on my chest and video the whole radiation process, which I thought I'm either going to blow up or
Right.
it's going to be okay.
Yeah.
And I was asking the technicians and they're like, yeah, I guess that's okay.
I don't know, sure.
Seriously, though, like, would you really think a cell phone's okay under
It's
radiation?
not the answer I wanted to hear. Nah, I don't know. Go for it, I guess. We could try it. Never had anybody ask.
But I said, wouldn't it be cool to have a video of what went on at that point?
Yeah.
So don't know where that video is. I'm sure it's on some external hard drive I have somewhere. But I have to unearth that somewhere. So I just kept going on with that. And then it was time to do chemo. So, all right, you hear chemotherapy.
See, I thought
Yeah.
radiation and chemo, I swear I've always thought they were the same thing.
No.
Which is why I was very confused when you were saying you were
No.
in something that sounded like an MRI machine.
Yeah, no. My kids, I would say it was the zip zaps because it's just like a laser you don't see that's directing the radiation exactly where it needed to go.
Gotcha. Okay.
And that is supposed to shrink the tumor.
Mm-hmm.
So if you're doing that 5 days a week for 8 weeks, like I hope it's doing something.
I hope that's working. Yeah.
So at some point, it was time to start chemotherapy. Now, really nervous about this because you just hear the drugs, the hair loss, the sickness. I'm like, this is going to be god awful. And at the same time, I'm really trying to navigate the process of now going on disability, trying to handle health insurance. Like there was so much involved, still trying to be part of my kids' lives, still trying to be a wife, still trying to be all these things. And it was really, really difficult to navigate all of that. And then you're getting all this support from everybody, which you would think is a great thing. But then it turns into being something that's just overkill. It's
Right.
like, stop. Oh my God, Lauren. Oh my God, Lauren. And just be like, oh, hey, Lauren.
I'm not dead.
Yeah.
Yeah. I'm
Right.
all right. I'm right here. I mean,
So-
I appreciate it.
Yeah,
But-
yeah. So, and then there was like family members I couldn't tell. Oh, because then they get too worried. And
Yeah.
worried. I'm the one that's going through this, but fine,
Yeah.
fine. I would have friends from the schools come on their lunch break, come hang out with me. My husband at the time, play cards, do whatever. But then the next thing I wasn't prepared for was how they were setting me up for chemotherapy.
Mhm.
So you're thinking an IV, you
Right.
got some drugs on a pole, shooting in you, you sit around.
Drugs on a pole.
Yeah. But I mean,
Yeah.
that's like what you're thinking,
Yeah,
right?
yeah.
Okay, so essentially that's what it is. Except they said, oh, we have to insert a PICC line in you. I don't remember what exactly meant, but it's something catheter. So think like, when they stick a catheter up you for urine or
I
something.
don't want to think about it.
Okay, well, just go
I'm
there.
just kidding. Yeah.
Go there and think about when they have to
Right.
stick something up you so you can pee.
Right.
So this is a catheter that was put in my right arm. This way, every time I had chemotherapy treatments, they would just connect to
Just
this
putting a tap
tube.
on you.
Yes.
Yeah, a little
there you
tap.
go. Relate
Yeah.
to the viewers. Just putting
Yeah.
a tap on.
Yeah.
So they're putting a tap
connect.
on.
Quick connect.
Yes. However, again, no explanation what you're going through.
Right.
No idea. The nurse is like, she's doing this every day. A nurse. So it wasn't even a doctor, which I do not discount the nurse at all.
Right.
But you just don't know what you're getting involved in. Laying back on a table, happy I was fully clothed for all of this. She's got an ultrasound machine right next to her. And again, no idea. So they're sticking this catheter in, and I can feel it going through my body. It had to go from my arm, so my upper arm, through the veins to get to a large vein next to my heart.
That's crazy.
So I feel this. And all I'm thinking is, you've got to be fucking kidding me. You didn't tell me this is
Right.
what this was.
Do you remember what it felt like?
It was
Like,
little,
was it like
it wasn't painful.
just pressure? Or
It was
like,
little flutters. So I'm like, listen, I'm already dealing with anxiety. I already am on medication for anxiety.
Right.
Here you're putting me in this position. I'm all by myself because I'm thinking, you're just installing something. I'm fine.
just installing something.
Yeah.
Yeah.
Then it's in near my heart.
Yeah.
And she's seeing it on the monitor. Yeah, it looks like it's in the right place. Great.
I mean,
And
it looks like it's in the right place, you fuck. It's near my heart.
right. Like, don't
better
go too far. Don't pull back.
Right. We need to use coordinates here. Like, what? It looks like it's in the right place.
I mean, they had to make sure it was in that right place.
Right.
Because then that would be the quickest way chemo would get through my bloodstream.
Right.
So why not choose that big spot?
Yeah.
So I remember she puts it in, and I'm feeling it fluttering in my chest. And it's not my heartbeat, it's this flutter. She goes, no, you don't. Yes, I do. I'm telling her, I feel the flutter. All right, well, let me try to pull it back a little bit. So now she's playing with it all. I'm feeling the flutter. It's just so uncomfortable. I'm going to lose my shit at this point.
Right.
Okay, finally we get it okay. Then I have to go take x-rays, make sure it's in the right spot. So now I have this thing hanging out of my arm because now you have this piece hanging out of your arm that they have to tape all up to your arm.
Right, okay.
And that's going to stay there.
So it's like a plastic, like IV tube looking thing?
Yes.
Okay.
Yes. And that's going to stay in my arm for 6 weeks because every time I go to chemo, they'll just hook me up, hook up the tap, get my drugs, get my drugs. So you don't realize just how uncomfortable it is having this thing hanging out of your arm. You have to wear this big plastic sleeve to try to shower. Try to move over on a bed. You can't do anything.
Like, I mean, moving anything, I feel it would want to move around inside you if you're moving your arm. Like,
I didn't feel it because then she got it situated in the right coordinates, as you said, and I didn't feel anything. So come to chemo, and at chemo I felt really out of place because everybody else was so much older than I was.
Right.
Or there were a couple of people going through breast cancer treatments. Luckily, this drug, which my understanding they don't use anymore, it sat well with me. And I would just get really tired, really knocked out, but I never got sick. Right. So that was really, really good. So I did that for 6 weeks. So 3 times a week, 6 weeks, you come in, you get your chemo. I'd have some radiation in the morning. Then I'd go to chemo late morning. And then this was like a 6-hour day because I had to actually pee so much in this, they call it a hat. It was like this bucket hat. I had to pee so much before they could give me the drugs. And then I had to keep peeing to show this, to show that, and then wait for the drugs on the pole to go down. Like, it was this whole big process. Yeah. Again, nobody tells you anything. It's like you just learn as you go.
They're just throwing shit at you, and you're like, okay, I guess we're doing this now.
Yeah.
Okay.
Absolutely. So I continue to do my thing. And after a while, I'm like, all right, this isn't so bad. I'm getting through this. This is okay. There came the time where I told my kids, and I said, hey, mommy has cancer. Let me tell you what cancer means. Well, I remember saying, mommy has cancer. And my son said, so that means you're going to lose all your hair and die.
Close. No, most likely.
Yeah.
Yeah.
But that's what I had to associate it with and tell my kids, no, mommy's been doing this because my kids both, their birthdays is September. So here it is November. And I said, no, mommy's been going to the hospital ever since your birthday. And look, I'm okay. And I have all my hair. And that was really powerful for them to see and understand that. Okay. So then on one of my very last chemo visits, it was around this time actually. Well, it was at the end of December. And I brought Christmas lights and garland and a Santa hat, and I decorated the whole drug pole. I decorated my chair, everything. I said, I'm not going out. I'm thinking, this is my last Christmas. You're thinking of all these things about your own mortality.
Right.
So I decorated all that up, and that was great. And then on my very last radiation treatment, I brought my kids in so they could see exactly what it was and see the machine, see everything, even be out there while I went through my treatment. And they understood, like, okay, this is all okay. And I thought we were done. I thought we were done. Then they say, okay, things are going well. Now we're going to do internal radiation. And I said, what?
What is that?
Yeah, what?
Yeah.
Again, no preparation for this at all. All I was concerned with was, can we get it in before the first of the year for health insurance purposes? They're like, yeah. So I go see yet another doctor. Now, mind you, all my treatments were in 3 different hospitals. I probably had about 5 different doctors. And you want them to think you're the only person they're treating. You really, really do. But it's not the case. So some were better than others, and some just made you feel like shit because they didn't remember who you were, or they had to look at the chart, or they're calling me Laura instead of Lauren, and that irks the shit out of me. That's like, call me by my name, or they don't even call you by your name. So I remember going to this other doctor. We're going to do internal radiation, and he's really vague about what this is going to be. Oh, well, we're going to hook you up. Okay, let me just skip to it. Go into the hospital. I have to have a surgical procedure for the beginning of this. So at this point, I had never had any surgical procedures, never had anesthesia. So I'm freaking the fuck out beforehand. They have to give me stuff to calm me down. I'm so afraid I'm not going to wake up from anesthesia, all this nonsense. So I go in, I come out, and I have what we affectionately call the Terminator arm, which is sticking out from my body 8 inches. So it's a enormous rod. It's a really, I have a picture. It's a long metal rod with a bunch of kind of different little like knobs or something. And it's implanted up inside my vagina. So it gets real nice next to my cervix and the tumor. And then it hangs out about 6 to 8 inches outside of my body.
Gotcha.
This I have to have in for 3 days.
What?
Yeah, 3 days. So, and they put the nice catheter up there so that I could just pee into the catheter.
So you're just laying there.
Laying there for 3 days. I just spit on you, I think.
On the table, I think.
Sorry.
That's all right.
Oh,
Not the first time. You're good.
This was the absolute worst part of everything, that I have this thing implanted. And I'm laying in this bed for 3 days. I mean, you can't get up because this thing is sticking out of you. And if you get up, you're only going to hurt yourself.
Right.
Because your body can only bend so many ways. So as soon as you lift yourself up, you're going to move this thing, and you can't move it inside of you because it's just this long metal thing. I think overall it was about 12 inches long. So you got all that up you and all that out you. You just can't move.
Yeah.
So 3 times a day for 3 days, they wheel me down to the basement of this hospital.
Nice.
Now, this hospital, it's an incredibly renowned hospital in the nation, but this hospital was in the middle of an inner city. I mean, they're getting gunshots, like that's ER, like it's insane. So I'm down in the basement of already this hospital I don't want to be in. And it's like you're an afterthought.
What's the hospital?
St. Joseph's Medical Center in Patterson, New Jersey.
Okay.
Go look them up.
I was going to say, I mean, they're not going to listen to this. I mean, they might. If they do, whatever.
St. Joseph's, Chilton Hospital, and St. Barnabas, for all those that want to know where I was. So, and the journey from my room down to this basement was so eerie. You have a transporter who doesn't, let me tell you.
A transporter.
Yes. So
What
that's
they're called, yeah.
Yeah, transporter. Okay. I probably got the person on their first day every single time I had to go down there because we never made it down there on time. So I'm laying in a bed. I'm getting wheeled around down to a creepy basement, already in a creepy hospital because it's just, I was in like the old area.
Yeah.
So creepy. Down the basement into this creepy closet room that looks like they put all the extra equipment in the hospital in this room, and there was space for your little bed and your little radiation machine. So terrible.
Yeah.
And here I am terrified, like, what's going to happen next? So laying in my bed, spread your legs. We're now going to hook you up like if you were going to jump your car.
Like with
They're going to
wow.
jumping cables.
Yeah.
They're hooking you up now, turning on that radiation machine. And through this contraption they have implanted in you, you are getting that internal direct radiation to zap up that
I was going to say, are you getting shocked?
No, I don't feel anything.
Okay.
Which is great.
Yeah.
But it's almost I would rather feel something than experience all of it and have those memories of all of it.
Okay, yeah.
So it was just so crazy. I can't get that out of my mind what that was like. And it was just completely awful. Then you had to get that thing taken out of you.
Yeah.
So I don't even remember what that was like, getting to take it out. So, okay, it's the new year. Oh, everything seems to be going good, but we're still going to do a hysterectomy. We're still going to take everything out.
Like as a just in case kind of thing?
Yeah.
Yeah.
Like,
is that typical, like, procedure with cervical cancer?
It depends. It depends. I already had my kids, so that was like a factor. And then it was, well, what do you want to do? You still have a chance to develop cells and everything. And I said, all right, if you're telling me my best option is just to take everything out, then just take everything out. So it's actually called a total hysterectomy with oophorectomy, oophorectomy, because you have your cervix, your uterus, your fallopian tubes, and your ovaries. They can do a hysterectomy but leave your ovaries because that's what produces the estrogen in your body. Mine, they took everything. So everything got scooped out of there. And I asked my doctor, they're bringing me in. I said, listen, can I have an ovary?
Can I just have one of them?
See, we're talking about crazy stuff earlier.
Right.
I'm like, can I have an ovary? He said, no.
Why?
I said, well, why?
It's mine.
That's exactly what I said. He says,
Gimme.
why not? I said, because it's mine.
Put it in a jar.
A jar with formaldehyde.
Right.
I want my ovary.
Put it in there with some vinegar. It'll be all right. It'll stay just, You'll do
says-
it with pig's feet all the time.
He says, I can't give that to you. That's now waste.
Nope. It's okay.
That's waste, or I'm very big talking with my hands.
Oh, you're fine.
That's waste. I can't give it to you. And I'm like fighting him as they're wheeling me in. I'm like, but I want my ovary.
I would be too. Yeah. If like I got like testicular cancer or something, the first thing I'm going to be like, hey, look, before we do anything, I just want you guys to know I'm keeping them. Like if you have to take both of them or you have to take one of them, I don't give a shit. I want what you take. Like I want it back.
Bronze them and I'm going to hang them from
I'm
my
going to put it in
rear
a fucking, I'm going to put it right here on this table in a jar. Just right there.
I mean, I was like, what's the big,
Yeah.
I didn't think it was a big deal. Apparently, people don't ask these kinds of questions.
I feel like maybe that doctor doesn't get that question very often.
I don't think so.
I feel like a lot of people probably like. I mean, I don't know.
I don't know if a lot of people really think about wanting a piece of their ovary or have their ovary.
I'd ask for it.
So I think in a former life I was a doctor. I also think I was a lawyer.
Okay.
So part of me just had this kind of urge that I really wanted this piece.
Yeah.
So no. So I said, all right. Now, when you do a hysterectomy, you can either go up through the vagina and kind of suck everything out.
Sounds painful.
Or they can cut you, kind of like a cesarean section, and just take everything out. So they cut me to take everything out. So I said, hey, listen, while you're there and you open me up, can you just take a picture of what everything looks like?
Yo, what? Really?
I wanted a picture of my uterus and fallopian tubes and ovaries.
Did they?
No, he said no.
This doctor's no fun. Fuck this guy.
I mean, you can hear my story.
Thanks,
trying to, Dr. Robert Taylor. I'm trying to make this. This is how I have to handle it.
Right.
So I said again, come on, it's open.
Yeah.
Why can't you just take the picture? He says, no, I'll show you a picture in a book. I said, but that's not my uterus.
That's not me.
So this is all happening as they're wheeling me in to the OR. And I think they were like, let's get the anesthesia on this chick really, really fast so we can do this.
That's crazy. They wouldn't do what? Take a second,
picture.
man.
Like,
Douse my phone in hand sanitizer. I don't care.
You can't find some intern that has nothing to do that just can't take this picture right now. Yeah. So I was really disappointed I couldn't get a picture.
Yeah.
I think today I'd be able to get that picture.
Oh, I think so too. I think maybe
All
that's
the
why
shit
I'm
everywhere.
so I'm like flabbergasted by
Yeah.
them not being okay with this.
Yeah.
I feel like I feel like most doctors who are going to be working on me whenever I get down that to that point, they'll be my age and I'm like, oh, sure, dude, yeah,
Sure.
whatever,
Exactly.
yeah, whatever, yeah,
like
we can
it'll
do whatever,
be on
dude.
TikTok.
Yeah,
like that's what I think. But this was just on the verge of social media.
Yeah.
2008. So I was documenting things on social media. I was throwing things out there. It's nice to see those memories and everything. And then I just remember being wheeled in. And you're in this cold, sterile operating room. I can see the lights above me. And then you're out. And then I wake up and everything's gone.
What was that like being under? Was it just like, do you remember anything like when you were under, not like of the outside world, but like, was it just like under awake?
Yeah, under awake.
Just real
That's
quick.
It.
Okay.
That's it. Which is really nice. I mean,
Yeah. My biggest fear with surgery isn't that I won't wake up. It's that I'll go under, but the mix wasn't right and I'm just awake.
Could you imagine?
But I can't move.
I mean, if that was the case for me, at least maybe I could yell to have my ovary again.
Right. Take the picture.
Yeah.
What? Yeah.
So I remember like my family, my parents and stuff being there afterwards and my kids. And I woke up and then, you're feeling like shit for a couple days. And then finally I was like, I am really hungry. I haven't eaten in days. I want some food. No, your doctor has to approve. Well, you better go find him because I want some food right now. So in the meantime, I'm watching Bingo on the hospital channel with this old man. And what I want to think is like the old man's son who has nothing else to do but sit and call bingo numbers in a hospital with his dad. And I'm thinking they're like celebrities at the hospital because this is like the best thing going on after a hysterectomy. So I could play bingo on TV with these old men. So my husband actually found them and took a picture of them. So I have a picture of these two guys from bingo. So that was February 9th, 2009, that I had the hysterectomy. Total hysterectomy with oophorectomy. So everything's gone. Mm-hmm. And I'm like, cool. The cool thing about everything gone is, for women, hey, you don't have another period again. So I'm 33, no period the rest of my life. Fan-fucking-tastic. Sick. Yeah. Truly sick.
Yeah.
But then, now my body doesn't produce any estrogen.
Right. Not sick.
Yeah. Yeah. So, we reconvene in February 19th. I get the clear, whatever, bill of health. And I'm like, this is really great. This is really great. I'm happy. I'm healthy. I got that picture. I was taking selfies before Kim Kardashian was taking selfies because I have selfies, so many selfies of myself, obviously, through this journey because I knew how to turn that camera around and take that great angle without even being able to see what the hell I was taking.
Right. No front-facing cameras back then. Yeah.
So the quality was terrible, but I have a great selfie the day I was healthy in my car, and man, that was a great picture.
Yeah.
So then it's like, okay, well, what's next? So you have your follow-up appointments and everything. You see the doctor, and then they have to put me on some kind of estrogen, or else you're going right into menopause, which is something that normally doesn't happen until your 50s, 60s.
Right.
So I'm starting on this cream. I'm starting these pills. Like, it's all just disgusting and just terrible. And then I started having more psychological and like neurological kind of stuff.
Right. So with the hormone replacement therapy, that's something that I know not a lot about it, or I'm not going to claim to know anything about it, but I know that you can go a little nuts. Like just anybody, like a guy who has low testosterone, or I mean, even if you get on the wrong birth control, as a woman, and it's just like, because your hormones are all over the place, you are all over the place.
Yeah. I don't remember.
Did they get it right to begin with, or was it kind of just like you felt shitty and then eventually they got the balance right?
Different things. Yeah. To this day, the balance still isn't right. And we're looking at almost 13 years, 8, 9, 10, 11, 12.
Did they take any kind of measurement before they did everything, like to see how much estrogen your body was producing to begin with?
Maybe.
Feels like that's something they should probably do, and it probably just doesn't help very much.
They maybe did. So even to this day, like from what I went through, I am never the same person today in every aspect, mentally, psychologically, physically, emotionally. I am a very, very, very different person. And there's some really, really awful awful things I deal with now. The estrogen, that's definitely something. You get the chills, the hot sweat. Oh, not the chills, the sweats, irritable, basic kind of women stuff anyway. Yeah. Sex drive.
I'm not going to agree with you there. Like, I'm going to nod.
Yeah, just nod, say yes.
Yep, sure.
Your libido is terrible. It's like, because you're not producing anything.
Right.
Even artificial stuff is not really, nothing has really done anything. I'm not that same person that I was. I think, no, I was married at the time. And looking back, I think part of the breakdown of our marriage was because he didn't find this tumor. You're intimate with your partner, okay? And part of me thinks, like, I still think it today, like, how did you not know something was wrong? Okay. So I really grew to I don't even know if I even ever told him that I really resented him in some way for not knowing something was wrong. Like, literally, like, okay, when you're having sex with me, don't you feel something? Like, is something hitting you that wasn't there before? Yeah. So without it being consciously anything, I resented him for not being able to
Do you still feel that way now?
I do.
Or do you? Okay.
I do.
Interesting.
I do.
As a guy, to be honest with you, don't know that I would notice a difference. Like, I mean, maybe I would, but I'm not sure.
Yeah.
Like, it's not, I mean, it's sensitive, but it ain't like my finger, it's not like my fingertip. It's not like I can like feel like.
But that too, like.
Yeah, I guess. Yeah.
So, and we never talked about that. And there were many other reasons why the marriage broke down, but that was a big thing for me that I just carried and I still carry with me.
Mm-hmm.
So more of the effects was you get this chemo brain. So you're very, very foggy all the time.
Mm.
It's like, think like when you just haven't slept well and you just can't think straight, you're not focused. This was all the time.
Yeah.
I didn't take the direct way to get my undergrad degree. So it took me 19 years.
Mm-hmm.
So I had to stop and go for all my reasons. Of course, one during cancer, but that next semester are we going on time?
No, I was looking at something else.
Okay.
Yeah.
I jumped right into school at next semester. I'm like, I have to get going. So here's February, March. I finished everything. September, back in school.
Mm-hmm.
So I'm taking this class. I'm acing this history class. I still remember where I sat, everything I did. I'm answering questions like the biggest ass nerd in that class. I had my laptop out, so when he was talking about something, I just started Googling it, so then I knew the answers to participate. So, I was just slick. 2 grades, midterm, final. Midterm, aced it.
Mm-hmm.
Final, completely failed it. I had absolutely zero recollection of what we learned and studied to be able to.
And you attribute that to the brain fog.
Absolutely.
Okay.
And I even wrote that in my little blue book
Right.
that I wrote my final exam in at the end to hope for some kind of mercy.
Right.
And I said, listen, I just finished cancer treatments and everything. I can't even think straight. I can't remember
Any mercy?
anything. I got a C+ in the class overall, which an A and an F kind of balances to that.
Yeah. Yeah. I mean, he didn't have to put the plus on there.
He didn't, but it
he
helped
did.
the GPA just a touch.
Right.
But that is the one enormously awful result of cancer is that I've lost so much of my memory.
How long does that last, that brain fog? Is that like
I still think I have it today.
Okay.
You'll definitely read things that say there's no way you're going to have brain fog for years.
I'm interested to hear, like, if anybody out there is listening who's gone through chemo as well. I've got a couple relatives that I'll ask when I see them.
Yeah.
Soon, I think a couple weeks. But yeah, if there's anybody out there, I'd like to know if you're also, if you also like
too.
years later still experience that.
Yeah.
Yeah.
I want to believe it is, but I don't know myself otherwise. So is it just because I'm getting old? Is it just because of this, that? I don't
Could
know.
be a number of things. It could also be the hormones still not feeling right. I mean, it could be a lot of things.
Yeah. So I knew I wasn't well afterwards.
I mean, I'm sure that whole process is rough on your body and your mind.
Oh, God.
In general, in a way that's probably going to affect you for the rest of your life.
Me not being able to have the memories of my children before they were 8 or 9 completely break my heart.
Wow, you don't have that? Wow.
I can't remember much of anything. And that stings the most.
Yeah.
And I mean, I got this crazy ass memory that I'll remember 40 of your names in my restaurant on Saturday, but I can't remember things that happened with my kids when they were little. I have to look at pictures and I don't know if I'm remembering a memory or I'm trying to create it from pictures.
Yeah.
And my kids will say, remember this, remember that? I don't.
Wow.
That's really, 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 really hard to take.
Yeah.
Really hard to take. And I think that's why I want to be so close to my son. Now, I mean, it's a mother and a son. My kids breaks my heart when I can't talk to them always, but
yeah. I see your Facebook posts every time. Every time the one leaves, I don't know his name, but every time he leaves.
Brendan, he's coming on Monday. I can't wait. Yeah, so that's one of the worst things that came out of all of this.
Yeah.
It's just undescribable that you can't remember things.
Yeah.
The other thing was because of all the radiation therapy I had, my bladder's awful, bowel movements. There's so much that affects that whole region because that's where the radiation was.
Right.
That it's absolutely horrendous.
Everything just sucks.
Everything sucks.
Yeah.
So I kept up with my doctors after all of that. And then there was a point in time where I said, there's nothing up there. What the hell do I have to go to a doctor for? So I probably let it go 2-3 years, and I just didn't care anymore because what more could happen? Then we moved here. Yes, got divorced, met Charlie, the whole thing. We moved here, and I said, I got to find a doctor. So I find a doctor. And what happens? I have precancerous cells. I said,
Where?
how?
And
On my cervix. Everything else is gone, but there's a little piece of cervix left. So I have precancerous cells. I said, you've got to be kidding me. Where is this coming from? There's no HPV anymore. Where is this coming from? She said, there's just could be stuff that was left around.
And this had to be recent because you guys haven't been here that long, right?
No, this was in the last couple of years.
Yeah.
So then I go through another ridiculously painful, it's called ablation. Just the word ablation.
Yeah, it doesn't sound like an attractive word.
So think about when they cauterize stuff and it's just like, bzz, cauterization.
Okay. It took me a second to get through the accent.
Okay.
Cauterize is what I would say. Cauterize.
Oh, cauterize?
Yeah, cauterize.
Okay.
I don't know if I'm saying it right, but I've always said cauterize.
Okay. I say cauterize.
Is it with an O or is it with an A?
AU. No?
I have no idea.
I think it's AU.
I don't know. But I understand what you're saying.
So they go up in there, and now they start everything in there.
Oh, yeah. So look at this. Guys, you're not going to be able to see this on the camera or anything, but this scar right here,
yeah,
I had that done to me. That was a very large wart. And it's not quite the same. It's not inside me, but
totally
I know
not
what
impressed
you're
by
talking
that.
about. Yeah, I know. I wasn't expecting you to be impressed, but I realized what they were doing.
Okay, you got that.
Yeah. I had it done on my palm, not in my butthole. Yeah.
It wasn't quite my butthole.
But it
was
it's
the other hole. Yeah.
It's a hole that's inside. Doesn't feel good.
She's like, yeah, we're just going to go in there and we're just going to clear it out and stuff. So I'm thinking, how much worse could this possibly be than what I've gone through?
Right.
I am holding the table, cringing, crying.
Yeah.
It was so much pain. And then I called Charlie afterwards. I'm like, you will not believe what just happened to me. And I just felt like she just went in there with a blowtorch and just started blowing the shit all up in there.
Did they use any local anesthetic or anything?
No.
Nothing?
Nothing.
They were just like, yeah, we're just going to go up here and burn this out. That's nuts. They didn't hit you with anything.
Nothing.
I wonder if man, I feel like if it wasn't going to do anything, like if local anesthesia wouldn't do anything, they would tell you. They're like, hey, look, it's not going to do anything, so we're not going to do it. This is just going to suck.
Nothing.
They didn't say, they were just like, all right, we're going to burn it out now.
They just made it. I mean, she was this beautiful, older Southern woman and just came in with such charm and, it's going to be so great. Like she just enjoys the shit out of this. She made this so beautiful. She made this like a bless your heart good thing instead of the other kind of bless your heart. It's okay. And the nurse that's in there, she's like, you're okay? Are you okay? I'm like, no, I'm not
No, I'm not okay.
So this is just another offshoot of having the cancer. And then this comes, and then, how many years later you're still dealing with this kind of stuff. So she basically told me, it's a wreck up there. That's what she said.
Yeah, that's not what you want to hear.
It's a wreck up in there, and you're very short, she tells me. So the canal's very short.
Yeah. Your husband definitely should have felt something, I guess. Yeah.
Well, no, this is now after the treatment.
Oh, got
this
it.
is
got
now
it, got
currently.
It, got it, got it. Sorry, that was a distasteful joke, but whatever.
And I won't say anything about Charlie and the shortness.
Got it.
So.
Oh, man.
I didn't say anything. So she said it's just a wreck. It's a disaster up in there. You have so much scar tissue. You have so much going on.
Nice, thanks. Yeah, stuff
I
like.
Great.
Stuff
I should
I like
ask
to hear.
her for that picture too. Maybe she would have given me the picture as she's up there.
Yeah.
So, we get to this point where we celebrate this month, and I just keep trying to get people to go to your doctor. You can prevent this. When women don't go to the doctor and they're in stage 4 cervical cancer, they die. The American Cancer Society says this year 15,000 women will be diagnosed with invasive cervical cancer, and 5,000 are going to die. So this is a cancer that, for the most part, is preventable. So I don't want anybody going through what I went through when you don't have to, as long as you keep up. And I have different opinions about this. You get the HPV vaccine. After my treatments, they wanted me to give my kids the vaccine. Gardasil is the big one you hear about. Again, 2009, this thing just came out. My kids are 8 and 9. They're not having sex. I'm not shooting them up with Gardasil to protect themselves at that point.
Right.
They're like, no, it's fine. No.
Yeah.
You've had this out for a year. I'm not giving it to my kids. There's no rush. So maybe when they were 15 or 16, they got it and everything was fine. So I just keep trying to encourage women, go to the doctor. Men can get HPV as well. And men can get different kinds of cancers of the mouth because of this. So it's really important to just tell that woman in your life, whoever it is, did you go to the doctor this year? Did you make your appointment? You can't be scared. You can't feel worried about the whole modesty issue. It's just like somebody looking in your ear.
Yeah.
Basically,
Yeah.
you got to go because from one year to the next, I turned into developing cancer. It was just that quickly.
Well, makes you feel any better? I am compelled to, as soon as we're done, ask Crystal, because I'm not sure if she's been to the doctor.
Yeah, yeah.
You know, I mean, she's really good at keeping up with that stuff. I'm just like,
Yeah.
I don't know. I don't know if you went or not, but I'm going to ask.
I mean, I can only hope that all the treatments have really improved since then. It seems like it was just a short period of time ago. Like to me, 2008 was not that long ago,
Right.
but to some it is a long time ago, especially with medical advancements. Like I said, the chemo drug they don't use anymore. I hope they're not playing the VHS tape anymore. I hope this internal radiation with the Terminator arm, maybe that's not around anymore. I just hope that there's been a lot of improvements and women haven't gone through that because these are memories that are etched in my mind. And I'm sad that I lost so many memories and replaced them with these memories that are so awful. Like there's definitely a PTSD that you go through when you have this.
Yeah.
And then dealing with it and then thinking it's gone and then it's back again. And then you have all these reminders of each date that you were healthy, that you were sad, that you were stick out in your mind. So every year on my cancerversary of being healthy, I post it. Every year, almost every year when I was diagnosed, I post it. And you know, you hear people on Facebook, whatever, Instagram, oh, here's another cancer post, here's another this. No, because I'm legitimately telling you, here's this picture of this thing hanging out of me. Go to the doctor.
Yeah.
Just go to the doctor. And if you go to the doctor and something's wrong, chances are you're going to be okay.
Yeah.
But it's really...
It's important.
It's important, but it's just an awful, awful road. And I wish I could eliminate some of that from my memory, which, you know, we all have things we can eliminate. But I feel like that was a whole different person ago.
Yeah.
And that's not the person I am now, but I'm still dealing with those effects and I forever will.
Yeah.
I've had conversations with doctors about getting your innards lifted.
Huh?
So it's like the bladder and everything. Well, think of when your uterus, so everything there is gone. So other stuff starts shifting.
Oh.
And I start saying, I literally feel like my bladder is going to fall out of my vagina. Like, this is what I say to people. And to nurses are like, yeah, I've seen that happen. Thank you. So there's a procedure where they can go in and start like lifting things and I guess kind of putting them back where they sewing them back in different places.
I wouldn't even have thought of that.
Right.
Yeah.
And there's going to come a time where I'm going to have to take that seriously and say, listen, you have to do something here because this is not good.
Do you think that's got anything to do with the bladder issues you were talking about earlier? Like, I don't know if by that you meant like you feel like you have to pee all the time.
Yeah, there's definite intense bladder issues, which is also a result from the radiation right in that same area.
Okay.
Yeah, so that bladder and bowel issues definitely have to do with the radiation that was right in that same area.
Okay.
So, I mean, and add on that you're a mom, you know, you had kids and everything, all that stuff, you sneeze and you pee anyway. Yeah. So multiply that times 10 and it gets really bad. And the doctor's like, well, just wear a little pad and you'll be okay. Listen, I just don't want to pee. Yeah. Pee myself.
Yeah.
If you can put butt implants in somebody's ass, why can't you do something to make this bladder guy just stay where he has to stay and help me out a little bit here.
That's a lot I didn't know. Mm-hmm. That's the whole point of this podcast for me. This is a selfish project. Like, it's a passion project. You were saying something
Passion is selfish.
Right. You were saying something about, like, when you were asking me, like, if the audience would like this or would take to it or whatever. I don't know. And I'm like, I don't know. Like, I'm sure. I mean, I guess they listen to all the other random shit that I bring on, and this is a very important thing, and why not?
I know your audience seems to be younger from what I see, and it's a little more
to the 30s,
exciting. Like, I'm 46.
Right. But like, when you were diagnosed, you were 33, right? You said 32, 33?
I was 33. Yeah.
So, yeah, I think they'd be interested in this. I'd say it should be.
So every January is Cervical Cancer Awareness Month. Mm-hmm. I like to follow the National Coalition of Cervical Cancer, which is NCCC. There's also something called Survivor. It's CER Vivor, taking on like the cervical.
That's marketing right there. Someone got a raise for that.
I wish. There's a lot of great things you can do to advocate and just be a part of it, and even just educate yourself some more. Mm-hmm. I got the tattoo probably a year after I was healthy, because I wanted an absolute reminder all the time of what I did and what I went through. I'm happy to be here. Happy to be here. I would not want my daughter going through this. I would not want anybody else to go through this. But it's still happening all day, every day. And you hear about another woman dying from it. And you don't hear about that. You hear about breast cancer. And believe me, I don't want to take that away from anybody, because that is huge, and that is an enormous killer of women, and that's a big deal everywhere. But there's a lot of other female cancers that are out there that people are not realizing can have an enormous impact, and you just don't realize it.
Right.
You don't realize it.
So, wrapping this up, what do you want to leave? I mean, I'm pretty sure I know what it is, but what do you want to leave everybody like that's listening with? Like, if you had to wrap all this up into one, like.
The obvious thing is to get to the doctor, that of course. But the other thing is, I don't want a woman to have the memories in her mind be the memories that I have. Mm-hmm. Those traumatic events, the lack of knowing things. I mean, if I'm going to pee myself for once in a while, that's nothing compared to if I had the memories of my children back again. Mm-hmm. So it's just definitely get to the doctor, because it's absolutely preventable with early detection. Decide if that HPV vaccine is something for you or not. Mm-hmm. I did not ever get it afterwards, and my body never presented with HPV again, because that is just kind of like the next step, like HPV, and then it's, cervical cancer. Mm. So it's just about early detection. Talk to every woman in your life about it. It doesn't have to be an awkward conversation. Just say, go to the doctor. Yeah. And I just don't want anybody to ever have to have the memories that I have of what you went through. Yeah. Because it just sucked.
Well, thank you for sharing that very intimate story.
Thank you.
I don't know if that's like, no, not at all. It was fine. Okay. I wasn't sure where we were going. Like when you were like, hey, it might be a little graphic. I was like, okay, I'm cool with that. I don't know.
I don't know what's graphic, to people. Yeah. So,
I grew up with Saw movies. I'm good. But yeah, I don't know how that is to like for you to share, but regardless, I appreciate you coming on and sharing it with me.
I appreciate you allowing me to just in any kind of medium to get the word out. If one person takes to this and it makes a difference in one person's life, then I feel really, really great about that.
Well, I'm sure it will.
So that's just what the important thing is, helping out each other. I say this in my job as a career counselor. It only takes one person to give you a job. Mm-hmm. Hey, it only takes one person to help save somebody else's life or somebody who's listening to this today. Yeah. So that's it.
Well, thank you for coming on, Lauren.
Thank you, Kyle, for having me on.
Sorry, that wasn't on purpose. My throat did a weird thing. It closed up on me for a second there.
That's all right.
Yeah, thank you for coming on. Thank you for sharing the story.
Can I? Oh, I'm sorry. Can
No,
I
it's
just
okay.
share one more thing that
Yeah,
I
go for it.
completely forgot that's important? So I said I was working in the schools with children with special needs, and I'll never forget Eddie. He was around first, second grade. He wrote a letter to me because him and I were really close, and spelling mistakes galore. But it was, "Dear Miss Lauren, if you died,"
Sorry.
I know, "if you died, I would come to your grave and give you flowers
That was very sweet.
where you died."
Wow.
Like it was, I still have that letter.
Yeah.
I have a picture of that letter in case that letter is gone.
I feel bad for chuckling at the first part. It was
No,
it
that's
threw
quite
me,
okay.
Threw me off guard. He was like, "Hey,
I chuckled for a moment when this
if
kid's giving
you
me a letter.
died, like,
Yeah. And like died, everything was spelled wrong.
Right.
And it was the most beautiful, beautiful thing.
yeah, get that framed."
I should, but like, where's an appropriate place to frame "if you die" letter?
You can still put it in the drawer, but at least it's safe.
It's safe.
Yeah.
It's safe, but it's beautiful. So it's definitely something that I think about. So
Yeah.
to all you out there, I hope you have somebody that if you die, they will come bring flowers to you.
Yeah.
Thank you, Kyle.
Thank you, Lauren. Thank you. You guys, thanks for hanging in with a little. Blah, 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 blah. Sorry about that. Thanks for hanging in. A little over an hour. There we go. Make sure you're following Small Stuff Podcast on Instagram. Again, make sure you're following About That with O.B. Smith, Small Stuff Media, all the things, website, stickers, keychains. Go get one if you want one. Make sure you're following Cucina LaMantia on Instagram, as well as Godfathers. What are you guys on
got it.
Instagram with Godfathers?
Godfather's NC.
Godfathers NC.
think
Follow
so.
Godfathers NC on Instagram. You can probably just Google both of those and they'll come up.
Godfather's Greenville NC. I run it, but I don't know what it is.
Yeah, I don't remember. I follow
And if you're
you,
an
but I'm not
ECU
sure.
student, I'm a career counselor at ECU. Come see me.
Do that. All right. See you guys later.